our dream, without knowing if it was all achievable, was to have a dramatic impact. In the case of global health,
one of the richest people in the world, Bill Gates, initially made his fortune by founding and running the Microsoft Corporation. Nearly 20 years ago, he founded the Bill and Melinda Gates Foundation, where he now works all of the time. With an endowment of more than $50 billion, it's the world's wealthiest private foundation and aims to enhance healthcare and education and to reduce poverty. It's a key player in global healthcare, but controlled by just 3 trustees: Gates, his wife Melinda, and billionaire Warren Buffett. The foundation's been credited with helping to save the lives of more than 100 million children through increasing access to essential vaccines. But it's not without controversy. Critics say it has excessive influence over healthcare policy in the developing world. Some argue its vast resources but narrow focus on healthcare provides a band-aid to health crises that are caused by deeper political problems in many of the world's poorest countries. Many of the people exposed to the diseases that the Foundation aims to eradicate live in Sub-Saharan Africa, and that's where much of its work is focused. At a recent African Union summit in Ethiopia's capital, Addis Ababa, Gates came to meet with heads of state to talk about healthcare.
almost as many children will be born in Africa.
But specifically, what was he trying to accomplish? And how does he answer to those who say his foundation tries to solve problems that some of those same heads of state seem unwilling to address themselves? We'll discuss all of this with Bill Gates as he talks to Al Jazeera. Mr. Bill Gates, thank you for talking to Al Jazeera. So we're here in Addis Ababa, the capital of Ethiopia, which is the seat of the African Union. African leaders, you're hoping to talk to them here. What are you hoping to get out of it?
Well, I was invited to come to the summit and give brief remarks. My focus is on the opportunity of the human capital here in Africa, that if the right things are done with the young people in terms of health and education, that there's a very bright future for the continent. There's a lot of great exemplars here who've done an amazing job getting their primary healthcare system working, and no reason why that can't be done in all 54 countries.
And in terms of specifics from the summit, are you hoping to get anything concrete from this meeting?
Well, the health meeting, there'll be a number of pledges and discussions about the big health funds, Global Fund, Global Alliance for Vaccines, which both over the next 18 months have major replenishments going on, and seeing that some domestic resources from the African countries are going into these causes will help a lot with that. And there needs to be a clear message about these countries really valuing that work so that we can continue cutting HIV deaths, cutting malaria deaths, getting more innovative vaccines out to all the children of Africa.
And the Bill and Melinda Gates Foundation focuses particularly on healthcare in some of the poorest countries in the world. But what's the reason for this focus on healthcare?
Well, I was stunned to learn that hundreds of thousands of kids, most of them in Africa, were dying of diarrhea. Over half of those lives could have been saved if there was a vaccine that was used in middle-income and upper-income countries called the rotavirus vaccine. And so our foundation found other partners, particularly the aid donors, and created the Global Alliance for Vaccines. And so now that rotavirus vaccine is getting out to almost all of those children, and that these new vaccines are the biggest reasons why Africa's cut child mortality almost in half since Gavi was created. So it's kind of amazing that for less than $1,000 you're saving a life, you're improving the health of the survivors, and as you improve health, countries generally choose to reduce their population growth voluntarily. So you're making all the challenges of the environment and jobs and stability that much more solvable out into the future.
The foundation also spends money on public education programs in the US. Why is it that you do public education in the US and then health in the world's poorest countries, or why not education in the world's poorest countries as well?
Well, by far the biggest program we have is the Global Health Program. And that's over 60% of our money. It's helping to invent new tools like malaria vaccine, AIDS vaccine, and then supporting these primary healthcare systems to get out to all the children. In the US, we picked education as our big cause. And once we've had a major success in the US, I'm sure there'll be lessons for the entire world on that. But we saw the biggest deficit in the US is the lack of equal opportunity, which is what the country stands for. The health system, although very expensive, it's working quite well. We didn't see anything huge we could do there. We do talk to the people who do international education. We think that's very important. But taking on the big diseases and these delivery systems, that's our priority. That's where we have incredible depth of expertise. And over the next several decades, even something like malaria, we should get it close to eradication. So you can really bring a dramatic solution in health that enables education and prosperity.
So a lot of people think that if all the world's poorest countries were healthy, functioning democracies, then it's the governments that should be providing public health care. But the Gates Foundation, of course, is spending a lot of money on public health care. Are you not doing the government's jobs for them?
Well, absolutely, it's a job for government to do. And once countries reach a certain level of income, say like Vietnam or Indonesia or India, then they graduate from aid eligibility. That is, they're entirely using domestic resources. And that's the goal of development aid, is to help countries graduate. So the track record there is pretty fantastic. Now, a lot of countries are, in terms of their being very poor or the lack of governance, that's not going to happen anytime soon. And so as human beings, we should care about those deaths, we should care about the malnutrition, and we should help build that government capacity. So we're not in to stay in any country for the long run. That's the government's job. But take something like creating a malaria vaccine. The poorer countries who have malaria don't have the skills or the resources to do it. And the rich countries, they haven't seen malaria for a long time. And so there are a few things, what some people call global public goods. We're having a foundation pick those scientists, get behind them, show the patients. These are 10 to 20-year projects, many of them. And you have to have multiple approaches and change based on what looks like it might be successful. There's a role that our foundation saw that wasn't being fulfilled, but it's not the long-term funding of the health system.
A lot of healthcare campaigners in many of these poorest countries are skeptical about the political will of the government to provide the healthcare that it should be providing to the population. Often they argue it's not a priority, and corruption, of course, is a threat, or too much is spent on big infrastructure projects and other things. What can the Gates Foundation, or what does the Gates Foundation do to try to hold these governments to account for the money that they should be spending on healthcare?
Well, we're purely in an advisory role. We're not in control of any decisions. The World Health Organization is in working with these countries. The one thing we can do is we can highlight the exemplars, and Africa has lots of exemplars. Even governments where some of the other functioning isn't too strong, like Zimbabwe, manages to keep its primary healthcare system functioning fairly well. Some that are fairly well off, like Nigeria, actually, particularly in the north, don't manage to make the primary healthcare system work well. So when leaders are interested in improving, then there are lessons, from Ethiopia or Rwanda or many, many countries that can be applied. So we're here to help when there's the will to go in and make that effort.
And I want to talk about the size and the scale of the Gates Foundation, which I understand is the largest philanthropic foundation in the world. I think you're spending about $4 to $5 billion every year. I mean, that's as much as or more than the entire government budget of many of the countries in this continent. So that comes with, of course, an enormous amount of influence. You're a very big player in terms of global healthcare. But I understand that the trust is controlled by just 3 people. That's you and your wife Melinda and Warren Buffett. Isn't that an enormous concentration of power and in a sector that's, of course, meant to represent and help millions of people and meant to include a diversity of opinions and voices?
Well, the resources we're using for our work don't come from governments. They're not solicited from other people. This is taking the success that Warren Buffett had at Berkshire and the success I had at Microsoft and applying those resources. In a free market system, people can take their wealth and spend it on consumption or pass it along to their kids. What we've chosen to do is focus on the diseases of the poor and make sure that the best scientists in the world are working on HIV and malaria and malnutrition and prematurity, things where the understanding is still not there. And it'd be great if that had been done before we came along. Actually, in health, the amount of controversy is less than you'd expect because the idea of saving children's lives is just not that controversial. And so we built the infrastructure that can measure these deaths and the malnutrition through what's called the International Health Metrics and Evaluation, which is funded by us. Now we know the various causes of death. It's called the Global Burden of Disease. It's a brilliant website. Lets you see over time, by country, by age, by disease, what's going on. And it's clear you should take the things like malaria, diarrhea, pneumonia that are killing lots and lots of kids and figure out how to save those lives. And so there's always tactics about, okay, which drug should we put the money into? Or someone thinks, okay, my disease is ripe for a breakthrough. But we're all united by this idea that lives have equal value, and what's being done, falls way, way short of taking the richness of the world and the great science of the world and helping the children, particularly in Africa, to live healthy lives.
In a lot of these poorest countries, democracy activists and political opposition would, I think, argue that their healthcare is just one symptom of a much more fundamental problem of governance, a lack of democracy. We're talking about countries that have disputed elections or sometimes no elections at all. They would say that there's a myriad of problems and that healthcare is a symptom of something much more fundamental. You have the foundation has a lot of wealth and a lot of influence. Just by going for healthcare, is it like you're putting maybe just a band-aid on these much bigger, more fundamental issues?
Well, certainly if someone knew how to write checks and create perfect democracies, then that should be looked at as a potential investment as opposed to giving a kid a measles vaccine and keeping them alive. I'd still argue that a measles vaccine, no matter what form of government that child lives under, those parents do care. And measles vaccine is a fairly cheap thing. We've cut deaths in half. And there is no great correspondence between form of government and how well the healthcare is run. Nigeria collects the least in taxes of any country of any size. And so even though it is a democracy, the primary healthcare system in the north is not delivering. And so, it doesn't, just because you have a democracy doesn't necessarily mean that those things happen. Now, as countries get wealthier, which does mean being serious about the health, they do tend to become more democratic.
And do you think there's a sequential chain in development that begins with healthcare that can then bring other developmental benefits? And if so, how does it work?
Well, of the overall aid, which is about 130 billion a year, which is mostly from the rich governments. Our foundation is pretty small percent. It is large relative to foundations because we're over 5 billion a year, but it's small compared to the government budgets or these donor amounts. About 20% goes to health, and that's gone up quite a bit since 2000. It's partly the HIV emergency, partly the realization of the profound success you can have at very, very low cost. The fact that we measure and we can tell you, even at a subnational level, what the disease burden looks like and is the healthcare system working well or not. And so if somebody wants to fix it, we actually get them lots of timely data at a pretty small district area. So yes, health, no one would ever say that health alone is enough, but if all those lives hadn't been saved from HIV, if we weren't coming along cutting malaria deaths, even the kids who survive are greatly damaged by the disease and the malnutrition. And so if you want to invest in their education, which of course you should, you want them to be healthy enough that cerebral malaria or malnutrition don't leave them stunted. And we know that the learning outcomes for the kids, which are a pretty high percentage, over a third, those are very, very limited. So health fits in with infrastructure and governance and education as the things that most people now live in middle-income countries, and so we've learned a lot about development and particularly the critical role that health plays.
I wanted to ask you about the role of intellectual property rights in public healthcare or in global healthcare, because Microsoft fought hard to try and to lobby for laws that would favour corporations in protecting intellectual property rights. And of course the argument for that is that corporations will be more inclined to invest more if their intellectual property is protected, so they can earn more returns. But many healthcare campaigners argue that the laws should go the opposite way, or that the laws as they exist act to the detriment of the people in the poorest country who need medicines. They argue that the intellectual property laws favour the big pharma and disadvantage the poor people who depend on medicines to survive. Having moved from IT to global public health, what's your view on this now?
Well, I think you're sort of mischaracterizing the Microsoft position, but in any case, the ideal case is if a disease exists in the rich world and in the developing world, then you get all your profit recovery and your R&D risk from the middle income and rich countries with tiered pricing. And so when Gavi goes in to get vaccines, or when Global Fund goes in to get malaria drugs or HIV drugs, there's no intellectual property increasing the price there. It's the cost base. And so our foundation is an expert in, okay, what is it costing on the margin to make these things? And can we use volume commits, or should we use a upfront spending to get a process optimized? And so the developing countries are getting these medicines at a cost-based price. In the meantime, the fact that these companies have an incentive to invent new medicines, that's the greatest hope we have, particularly for the non-communicable diseases, where today the costs of cure are just so very, very high. So sickle cell disease, we hope that gets solved in the rich countries, and then we can take and cost reduce that solution and bring it to these countries. So you won't see patent lawsuits in poor countries where somebody's suing something. There was one brief thing like that. South Africa was sort of low middle income, where on the AIDS drugs at first, the pharmaceuticals didn't have the tiered pricing. And that was a mistake. They agreed it was a mistake. And so we're very involved in making sure that those medicines are made very, very cheap. In fact, we just gave $400 million of volume guarantees to switch the first-line HIV medicine to a new set of drugs that are much less likely to have drug resistance. And so we made sure that the cost-based manufacturing, because of those volume guarantees, they could stay at this less than $100 a year. So we are, we have a lot of smart people making sure that medicines are getting to these poor countries at absolutely the lowest cost possible. And if somebody sees an idea to do that better, we're the place that will take a look at that, because we have no incentive other than improving these health outcomes.
I read that the Bill and Melinda Gates Foundation is due to wind up 20 years after both you and Melinda have passed on. But why not keep up the good work? Because many other foundations will keep going forever.
Well, our biggest cause, these diseases that are more prevalent in the poor countries, we hope to have largely solved. Polio is close to getting done. Smallpox was done quite some time ago. During my lifetime, or certainly within 20 years after, malaria, HIV, TB, every one of these diseases can either be eradicated or brought to a very low level. So there will be rich people in the future, and they will understand better whether the problem is, genetic modification, robots, what progress still needs to be made on climate change or other environmental issues. So, I can't, from my grave, be as analytical as I am today. And so these resources will go to global health, to doing our best to get rid of these things. So people, it's like when you read in a book about consumption and somebody died of consumption, you're like, what is that? Well, of course, it's tuberculosis, but in the rich world, you don't see it much anymore. These diseases should be a distant memory by the time our foundation wraps up its work.
And in the next 10 years, what do you think we can achieve?
Well, it's pretty exciting. We have a pipeline of new vaccines. Of course, there's the danger that the rich world is distracted, between turning inward or, various polarization things. The idea of keeping this aid generous, that's something that we need to remind people that even though it's far away, even though every once in a while they'll hear about some small percentage that went astray, the actual impact of these donations to lift these countries up is pretty fantastic. So, assuming we maintain this great commitment that the donor countries should be very proud of, and is being used to build capacity and drive towards eventual graduation, I think by 2030 we can cut under 5 deaths in half again. So it went from 12 million a year before our foundation was started. Now it's at 6 million a year. And by 2030, we think with some innovation, better delivery, we can get that below 3 million a year. So that's down to 2.5%, from 10% to 5% to 2.5%. And so, time is on our side. The science is making progress. People are seeing the good examples, as long as people maintain their commitments.
Mr. Bill Gates, thank you very much for talking to Al Jazeera.
Thank you.